So the way we'll do this is we'll start out with one of us reading the case background, and then as Kat said, keep it quite interactive, and get you guys involved as much as possible. Get your thoughts. Okay, so our first case is of a patient who is a 30-year-old man, and who has come to the GP because he has a sore red tongue, and he's noticed that he's feeling weaker than usual, and has recurrent mouth ulcers. He's been experiencing frequent paresthesia, and so this just means pins and needles, and has some poor memory as well. So, if you could all go to the Menti, and answer the question, what questions might you like to ask this patient? Okay, lots of answers here. Dr. Zirva, if you want to give your input on these.
I think those questions sound really sensible to start with.
Yeah.
So let's see how many of them actually get used in the consultation.
Great.
Give me a heads up when you want us to start.
Yeah, you can start now.
Yeah.
Okay. All right. Hi, my name's Dr. Zirva. I'm one of the GPs calling from the surgery, and we've got a video appointment with you today. Is that right?
Yeah, that's right. Can you hear me?
Yeah, I can hear you. Can you hear me?
I can. Yeah, thanks.
So can I just confirm your full name and date of birth, please?
Yeah, I'm Alif Aziz, and I was born in 1991.
Okay, no problem. So am I okay calling you Alif? Is that right?
Yeah, that works. Thanks.
Okay, cool. So how can we help you today?
Yeah, well, I've been feeling a bit. I've been getting these like mouth ulcers in my mouth all the time. Like, I've been going on for ages, for a few days, and it's just keeps being recurrent. And I don't know, it's just getting in the way of my life. So yeah, it's pretty annoying. I just wanted to know if there's anything you can do about it. Yeah. And there's also, I don't know, there's been, sometimes I'm getting like a tingly feeling in my fingers and like, yeah, just around my body, and I just don't really know what it is. And so I'm hoping you can do something about that.
I can certainly do my best, but yeah, I think it's really important when you've got concerns like this that you should speak to your GP, which you've obviously arranged an appointment for today. So let's kind of go through them kind of bit by bit. So you mentioned about the ulcers that you've been having kind of off and on. Kind of tell me a bit more about that.
Yeah, well, it's just been like in my mouth every like I don't know, every few weeks I'll have like an ulcer in my mouth, and it'll stop me eating, and you know, it gets in the way of my life, honestly. Like, I can't really eat the food I want to, and all this kind of thing. Like I can't eat hard food. It gets like stuck in my mouth, and like it really hurts. Yeah.
Doesn't sound very nice. So when you say off and on, how long is off and on? Is that?
Well, sometimes it can last quite a while. Like, I feel like sometimes it lasts like 4 to 2 days to like a week sometimes. So it can be quite a while. Okay. Yeah.
And you mentioned that during that time you really struggled to eat. So what do you actually manage to eat and drink during that time?
Well, I've recently gone like vegan. Well, not recently, like, you know, like a year or so ago. So I stick to like soft fruit as opposed to like, you know, like apples and stuff. Like stuff like bananas are quite good, and then like, you know, like some like vegan ice creams and stuff which is like soft, so it doesn't like hurt my mouth so much.
Okay, and you said that you became vegan a year ago. Any reason why you became vegan, if you don't mind me asking?
Well, I thought I just wanted to do it for like weight reasons. I thought it would be like a healthier choice, like just to keep my weight down, I think. Yeah.
Okay. Has weight been a concern of yours?
A little bit, but this has helped. This has helped reduce my weight.
Okay, Fair enough. So when you say that you've been having kind of ulcers in your mouth, how many ulcers would you have, and whereabouts in your mouth would you have them?
So sometimes they're like in my lip, like here, and then like sometimes they're like in the between my teeth and the side of my mouth, like inside of my cheek,
Yeah.
and then sometimes like on the roof of my mouth, which is quite bad. Yeah.
Yeah, sounds uncomfortable. How
Yeah.
how have you tried to manage them so far?
Sometimes I guess sometimes when I remember, I might take like paracetamol or something to see if that helps, but I don't really, not doing too much. I just don't really know what to do.
Okay. So paracetamol doesn't really make much of a difference. And then you said that usually within about a week, that kind of episode of ulcers calms down. And then kind of, is it every month that these episodes will happen again, or?
Yeah, I guess maybe less than a month, maybe like 2-3
Really?
weeks, every few weeks. Yeah.
Okay. And have you ever had a problem with ulcers before at all?
I don't think so. I don't think so.
Okay. And how long ago would you say these ulcers, like this problem of these ulcers kind of coming and going, how long ago would you say that started?
I guess maybe like 6 months-ish ago, maybe a bit longer.
Okay.
Yeah.
And how are you in yourself otherwise? You mentioned that you've been kind of otherwise feeling a bit not right as well.
Yeah, sometimes at work it'll be a bit like stressful, but yeah. Other than that, it's not too bad. Yeah.
Okay. And has kind of the ulcers, or you mentioned that you were having some other symptoms as well. So can you
Yeah.
tell me a bit more about those?
Yeah. I mean, yeah. As I say, I've been getting a little like tingling, like and stuff in my like fingers and like feet and stuff. But then also sometimes I feel like I I I can't remember what I was just about to say, or can't remember the name of people at work who I've just met this morning, kind of thing. Yeah.
Okay. And when you say that, so if I go to the pins and needles first, when you say that you've been having some kind of pins and needles, where have they been affecting you?
Sometimes it's been just like in my fingers and like my toes. Yeah.
Okay. And like anything that brings them on at all? When do you notice them?
Nothing in particular. Maybe after I've been sitting down for a while, maybe they'll come on, or if my like hands are a bit cold. I don't know. Sometimes when I'm like washing dishes in like hot water, they might come on that time. So it's just a bit sensitive.
Okay.
Yeah.
A bit. Is it a bit random, or would you say there's definite triggers for it?
I think it's random. I can't remember a particular trigger.
And when you do get these pins and needles, do they stop you from doing anything?
Nothing too much. Maybe I can't touch some things for as long, or like if they're warm or something, I might be a bit uncomfortable, or like, sitting down for too long. I can't really do that so much. And yeah, maybe sometimes when I'm walking loads, it'll get in the way, but it's not too bad.
Okay. And how long do these episodes of pins and needles last for?
Maybe like 5 minutes when they come about.
Okay. And anything that you've tried to do to manage those?
Not really.
Not really.
Maybe I try to not do things which bring them on so much, but other than that, not really.
It all sounds very difficult, having these sort of different things, and then on top of that, the sort of, you mentioned about a bit of forgetfulness. Would you has that forgetfulness affected you? Because you mentioned that you work. What do you do for work?
Yeah, I work as an accountant. Yeah, so
Okay.
yeah, it affects like social situations sometimes, and then yeah, maybe if I forget to do something that's quite important, I'm in like a meeting in the morning, I get told to do something in the evening, and I forget to do it. Sometimes that can be a problem. Yeah.
Yeah. And when you mentioned that you've been forgetting sort of names and things like that, have you forgotten anything kind of a bit more So, for example, have you forgotten to like lock the doors at night, or have you forgotten to close the cookers, you know, when you're cooking something?
I think maybe once or twice I've left the oven on without my noticing.
Okay.
Yeah.
Okay. Was everything okay?
Yeah. It turned
There
out
wasn't
okay.
any damage or any fires or anything like that?
No.
No. Okay.
Yeah.
And I mean, you've been having these quite difficult symptoms for some time now. So, you know, it's really good that you've actually come and had a chat with them about it, because otherwise you'd have just been sitting at home wondering what's going on. But had you had any thoughts about what could be causing all of this?
No, I don't know. Yeah, I'm not really sure. Yeah.
Okay.
I don't know.
I'm just looking through your records. I've got them on the computer with me. You don't take any other medication from what I can see. Do you take anything from the pharmacy?
No, I don't. No.
No? Any
No.
allergies or anything at all?
No.
No? Okay. Do you smoke?
No, I don't.
No? Do you drink much alcohol?
Yeah, I do a little bit. Yeah.
How much would you say you drink? In like a
Maybe
week?
in a week, maybe like a bottle of wine's worth a week or something.
Okay, no
Yeah.
problem. Just one other question that I remembered to ask. With kind of how you've been feeling, have you noticed any sort of weight loss or anything like that?
Yeah, I have. Yeah, but hopefully that's because of the diet working.
Okay.
Yeah.
You wouldn't say that, I mean, would you say that you've noticed any more weight loss because the ulcers are coming on and you're not actually able to eat and drink as much as you usually would?
Yeah, maybe, but yeah, I'm not sure. Maybe, yeah.
Okay, all right. So thank you for giving me all that information. I think it was really helpful having that conversation. So I guess there's a few things I'd like to do first. So once we finish the conversation that we're having, just because video consultations, they're not very clear. So I would like just a photograph of the ulcers that you've got. So the way to send those to me would be if I send you a text message and you reply to that, upload the photographs and they come directly into my inbox. And once I've had a look at those, then I'll either give you a ring back or I'll just drop you a text and just let you know what we're doing. There can be lots of reasons why people have these symptoms. There's a few things that you mentioned in your history that might be relevant. So with becoming vegan, I mean, how have you found that? Like, how have you found figuring out what to eat, what not to eat and things?
It's been like a learning experience, I think. So I sometimes I know what to eat, but I've been looking on the internet for like, meals and stuff. But it's still been a challenge finding the right things to eat, of like finding a balanced diet and stuff.
Yeah, I mean, we all know in our kind of traditional diet what things we should be eating and drinking to kind of get all the nutrition that we need for our body, all the right fuel. But when people become vegan, often they might not be having the right types of foods that have all the right nutrition in them. And it certainly sounds like there's some kind of a deficiency. Your symptoms do seem to fit in with something that we call B12 deficiency. But there are different types of deficiencies that you might be having similar symptoms with. So once I've had a look at the ulcer photographs, then what I plan to do, if it's what I'm thinking, is arrange for you to have some blood tests done. And in the blood test, what we tend to look for is look at your blood count, try and obviously look for B12, other sort of nutrients that you could be deficient to, make sure that your organs are otherwise working okay, your thyroid's working okay. Does that sound like something that would be okay for you?
Well, I don't really like needles very much. I don't really don't really want to have the blood test, to be honest. Yeah.
Okay. So I mean, did you have a bad experience when you were younger or some why do you not want to have?
I think when I was younger, I had a bad experience, like getting, it must have been like some sort of vaccination or something, which caused a bit of a problem. Yeah.
Okay.
Yeah.
Okay. Yeah, it's tricky, isn't it, when you've had experiences and they kind of affect you. So I suppose the trouble I've got is if we don't do the blood tests, we won't know exactly what deficiency you do have, and it's better to have the accurate reason. So when you do book in for your blood test, they can sort of lie you down and distract you and things. So if you were to feel a bit unwell, you've got lots of nurses around you and healthcare assistants. You're usually in a place of safety as well. Does that seem like something you'd be a bit more okay with? Or
could we like just give like what did you say, something like B12 treat? Could you just give me that and see what happens instead, or like, I don't know.
So a good question. I could give it to you, but the risk I have, like I said, is I might not be treating the right thing. If you had a deficiency in something else as well, I'd only be treating part of the problem. And it's always quite good kind of to know where you start with things. I mean, if for example, God forbid, they have you all nice and distracted and lay you down and all that kind of thing, and you still struggle with blood tests, then we can look at alternatives. I think at that point we would then have to think, okay, what do we do, because we're not able to get the blood results. But would that be okay?
Okay, yeah, we can try it. We'll see what happens.
Yeah. No pressure as such, but I do worry that you have so many symptoms and they are affecting you so much, and it would really be nice just to be able to give you the right diagnosis and treatment, rather than kind of confusing things and not treating the right problem. So once we've got the results of those blood tests, which are usually back within a week, we can then kind of talk about what treatment to give. Usually the treatment is for at least kind of 3 to 6 months, and then we review the situation then. In the meantime, I mean, your ulcers sound like they're quite painful. So there are a few things that might help that you can just buy from the pharmacy. So I'll text you the name, but it's called benzodiazepine mouthwash. They're really good. They're like quite good at kind of numbing inside of the mouth, and hopefully that should give you a bit of relief. And if you do need to take paracetamol, that's fine. I think the vegan diet, it might be that you would benefit with some help with that, just to make sure that you're getting all the right nutrition from it. So I've got some really good resources that I can text you across, just to make sure that you are kind of getting the right things that you need in your diet. Does that all sound okay?
Yeah, the information will be quite good. Yeah.
So I know we've talked about a lot of things today, but kind of ultimately, if you do feel that whatever we're doing isn't helping you and you are feeling worse, then just get back in touch with us. Otherwise, I'll send you a text right now, and then I'll wait for your photograph to come.
Okay, thanks.
Okay,
Brilliant.
all right. Okay. Take care. Bye.
Bye.
Great. Thank you so much, both of you, Dr. Zirva and Alif. I think that's really useful for all our attendees. So Kat, if you just go to the next thing on Menti, please. So now this section is interactive, but it will be extremely useful for you guys to consider, and then use these things that you've observed in your personal statements, in your interviews, things like that. So please do give this a proper go. So Dr. Zirva, do you want to just use these and go through some of them, and then talk a bit about the skills that you personally thought you showed the most?
Sure. So I think if we talk about skills first, so obviously there's a few skills that people have sent in. I kind of find these are kind of slightly complimentary, like you don't actually get told what skills you have when you are consulting every day. But I think with patients like Alif, it's really important when they've got so much going on and they are young, and they've got a job and they've got a busy lifestyle, that we don't forget to empathize. So that's 100% like what I really tried to do throughout. And for anyone who's had mouth ulcers, they're really uncomfortable. Anyone who's had pins and needles, or anyone who's been a bit forgetful, put it all together and it's a complete, it's a nightmare. So just to kind of care about how they feel, there's certainly no harm in that. I suppose kind of gathering information, it takes a bit of sort of work. Some people are very forthgiving with what they want to tell you. It doesn't take very much for them to tell you the whole, they've already got the whole story prepared, ready to tell you when they've got the consultation with you. Some other people are a bit more reserved. So there are techniques that we try to use when we do start a consultation off to try and get the most information. And the most information should be what the patient is telling me, rather than me asking the patient very specific direct questions. So the start of my consultation, I always try to make it open. So I ask a good few open questions just to really gather as much information. And then I'm not sure whether people realized, but I was trying to then hone down and ask more specific questions to really get kind of figure out if, for example, with the ulcers, a bit more of a story with the ulcers, a bit more of a story with the pins and needles, and then a bit more of a story with the memory loss. Sometimes patients worry that, you know, they're talking about more than one problem at a time. And we all know in the NHS, when you go to see the GP only really wants to talk about one problem. And some patients don't realize that those different symptoms are linked. So again, that's, I suppose, another skill, trying to figure out, is that all linked together or not? Yeah, and I suppose the other skill that I think is really important, which I guess when I was training as a GP and when I was training as a medical student, as well as a kind of a trainee after that, was whenever I used to observe consultations, one of the things that really used to annoy me was when doctors used to interrupt what the patient was saying. Oh, I hate it, I despise it. So again, that's another thing I try to do. Although there are sometimes situations where you do need to be able to interrupt the conversation because you've got someone really chatty in front of you. But here, you know, I think it's really important that you listen. I mean, it'd be interesting to kind of, I don't know whether you guys are going to ask Alif what he thought. That'd be quite interesting to add in as well, just to kind of get his perspective on what it's like to be kind of listened to. I don't know what you think.
Yeah, Alif, what did you think?
Yeah, I think, like as you say, it can feel like when you go to the GP, you want to like say your concerns, don't you? And so when the GP listens to you and makes you feel like you've said what you wanted to say, and you've like mentioned all your concerns to the GP, so you feel like you know that you've said everything that you wanted to say. As I say, it makes you feel like better, I guess. I think, because it makes you feel like something's going to be done about the problems that you've brought up and so on. So I think it is really useful in consultations for the GP to not interrupt you, as you say, and let you speak. And as someone has just said, feel more reassured that your concerns are going to be addressed.
Yeah, I mean, that's, I think, what all of us as doctors try to do. That's the aim, I suppose, through medical school and everything like that. But it's always kind of good to get the other perspective as well. I'm not sure whether people saw in between, but again, this is like more detailed about consultations and consultation skills. So basically, how do you talk to a patient skills? We use a bit of a mnemonic, which is ICE. Ideas, concerns, and expectations. Sometimes we ask them explicitly if it's not obvious from the conversation exactly what the patient wants or what they think is going on. Other times, if it's coming out naturally what they think is going on and what they want from the consultation, then you don't really need to explicitly ask for it. So I don't know if anyone has heard about ICE, or why, does anyone understand why it's an important thing to have in a consultation? Feel free to let us know in the chat, but kind of generally speaking, the reason why I always try to use it anyway in my consultations is because sometimes I think, well, I've got my ideas about what I think's going on. You know, I'm a doctor, right? So I've studied, I've been a doctor for how long? 8 years, 9 years now. So I've spent a long time studying about problems and things. So I've got my own ideas, but my ideas aren't always the ideas that the patient's got. So, you know, even though I probably know what's going on, the patient might have a completely different idea or a completely different concern. And then if I don't address that concern, no matter how, as a doctor, you feel like, whoa, that there's like zero probability of that being the case, until you address those concerns and those ideas and those worries, the patient won't leave the room happy. So ideas, concerns, expectations. So I try and use that in my consultations. Let's see if I remember to use it in the next consultation as well. But yeah.
Right. Just a couple of things that we wanted to ask you that we thought might be quite useful from this consultation. Could you talk a bit about how you dealt with Alif's phobia of needles, and your kind of process when dealing with that?
It's a really tricky one because I like, when logically that's the sensible thing that you need to do, but at the same time you can't make them feel silly for their whatever their worries are. It might not be a worry that you have, but that it's a completely justified worry. My best friend left medicine because she was needle phobic, right? So I know needle phobia isn't just, oh, I'm a bit scared of needles kind of. Some people are literally just a little bit scared of needles. Other people literally, they will have anxiety and panic attacks because of needles. So you have to put yourself back into that patient's shoes, and negotiate. That's probably the skill. Like, I would never have thought as a doctor I would need to be learning about negotiation skills. I always thought that was sales and marketing, but no, that's also part of medicine. So in this situation, I mean, there are some times where, for example, I don't know, if I'm suspecting a chest infection, I could be extremely thorough and I could ask them to have a chest x-ray done. They might say, I don't want a chest x-ray, could you still give me the antibiotics? On that probability, I might not do a chest x-ray, I might just give them the antibiotics, because it's not ultimately going to change what I do. Whereas in this situation, because yes, the most likelihood is it's a B12 deficiency, but I'll be honest, it's been a long time since I've seen B12 deficiency with all the symptoms that Alif's had. So it could be lots of other things. It could be a mixture of deficiencies. And if I'm only treating one problem, I'm not treating the problem properly. And potentially, even with vitamins, people forget, if you have vitamins in excess and you're not having the right vitamins, then that's actually causing you more harm. So you need to know what you're treating. So it's a tricky one. I guess I just try to be honest and share exactly, without making him feel bad about having the needle phobia. Just try to give him kind of where I'm coming from, really, and seeing whether we can meet in the middle, also trying to accommodate for his phobia. We have couches, and sometimes when you reassure patients that the environment is safe, so that they're not going to be in the middle of a supermarket having their blood tests done. It's going to be in a safe environment, private environment, with people around that know how to deal with him if he was to become unwell or like pass out. And I think hopefully he felt reassured.
Yeah, that sounds really great, and insightful about like making sure that they don't feel or embarrassed at all, because it's a natural thing. Could you talk a little bit more about dealing people? In this case, Alif might not have an eating disorder, but potentially dealing with people with an eating disorder or a disorder with something to do with their diets. How would you encourage them then to make a change, and improve their lifestyles?
That's a really tricky one, and that's not normally something that we can manage to sort of deal with or cover in like one consultation. So, for example, this problem that we spoke with Alif about. I mean, his aim of becoming vegan was to lose weight. Now, Alif to me doesn't seem like someone who's particularly kind of got weight issues, but I can only see this much of him. Okay, I can't see the rest of him. I've not had enough time to kind of necessarily discuss about his mood and his mental health and things. But in other people, the reason why we worry about eating and disordered eating is because in this country, I guess, we live in a culture where there's a big focus on weight, and losing weight, or being the perfect weight, or being the perfect figure. Social media and these things really haven't helped. So I'm slightly more aged than everybody else here, but when I was your age, and when I was a bit younger than you, in my teens and stuff, we only had magazines and TV. Those are the things that we were influenced by. So what Tom Cruise looked like, or what one of these other actors and Hollywood actors looked like. That's what we wanted to be like. So that was the perfect image. Whereas now it's like, Instagram, social media, it's literally everywhere. So we've seen a ridiculous amount of eating disorders, mental health problems through the roof. COVID's really not helped. And it's a very tricky consultation to have, because often patients don't have insight that they have a problem. So, you know, they have problems with what they think about their weight, what they think about themselves. And we start wondering or worrying about a mental health problem when it starts affecting them, affecting their sleep, affecting their relationships, things like that. It's, again, it's a very tricky thing to say, oh, the diet that you're on is probably not helping, or maybe you shouldn't have gone on that diet, or things like that. I suppose in our remit, our role is to basically identify the problem and help the patient get some insight. Often once the patient has a bit of insight, they automatically start to realize what they need to do, and you don't need to tell them what to do from there. So if it is that they've got unhealthy eating or dietary habits, just by giving them a little bit of insight without making them feel bad makes a huge difference. If it is that you're struggling with the insight, or they feel like they're not able to try and manage it themselves, then we refer them to the appropriate people to get some help for their mental health. It's difficult because, like I said, society here, especially in the UK, has a real problem with disordered eating. You know, I see people who are on a diet one week, they're off the diet the next week, they're on a different diet the next week, whatever's in fashion. But they will never be diagnosed with a mental health problem because that's considered normal in this country. But where it starts to affect your life, it starts to affect your relationships, it starts to affect your mood, these sorts of things, then you really start to worry about a kind of a mental health problem. So I'm not sure if I've quite answered your question. I think I have, possibly.
No, that's really great. That's really insightful. Thank you so much. I think there's a few good questions from the students, so we'll go to these. So Kat, did you have one in mind that you thought was especially good?
Yeah, so I think the question about what happens if a patient is disabled or incapable of speech for explaining what they have, I think that's a really interesting question considering online appointments now. So during the sort of COVID situation, it must be really hard for people who don't have access to technology, and don't have people that can help them either. So how have GPs and people like yourself, Dr. Zirva, accommodated for that part of the population during the pandemic?
It's been really hard. It was one of the first things that I realized when COVID was starting, was there was going to be a reasonable size chunk of people who were not going to be able to get the access to care that they needed. They never had good access to care in the first place. I remember patients, if you think about it, like for someone who is, for example, disabled, physically unable to walk, dependent, anything like that, for them to come to the GP surgery, it's just hard anyway. They have a special car, they have someone to accompany them. Then when they come to the surgery, they have to come in through the wheelchair access place. And then usually kind of consultation rooms are accommodating in terms of the size of the wheelchair to get in. And then they come in and they're probably tired after that journey as well, because you don't know how long it's taken for them to come and then to wait outside. And then obviously you're relying on the carer then to tell you the history and to try and give you some information about what's been going on. In the beginning of the pandemic, it was awful. You don't understand, it was awful. Like the government said to us, we could only bring people in the surgery that really, really needed to be seen, because we didn't know anything about COVID. COVID was horrible, everyone was dying. And we couldn't take the risk. So we obviously have been doing telephone and video consultations. For me, video consultations have been a lifesaver, because on the telephone you can hear what they sound like and things. Obviously, in someone who's disabled or someone who can't talk, that's hard. You can't have a telephone consultation with them. You would then have to rely on someone to speak on their behalf. But a video consultation, for example, one of the benefits of that I didn't realize it was going to be so beneficial was you could see them in their own environment. And yeah, okay, someone would have to sometimes interpret for them or tell you exactly what was going on, but you saw the environment they were in, you saw the room that they were in, you could physically see them. Yes, you couldn't kind of put your hands on them and like assess them, but it was still better than what we had. Now it's obviously kind of, once we knew a bit more about COVID and things, these sorts of patients, we were wanting to see them face to face because there was no other reason. There's no other way that we could properly assess them, really. I mean, minor things you can assess from a distance, but there's no comparison to sort of the face to face. However, masks, oh my goodness, you know, whoever has invented these see-through masks, they should win a medal, because these patients are going to be missing out on, you know, if you're hard of hearing, if you can't talk, like there's so many older patients, for example, they've all got hearing aids and they come and see you, and because you've got a mask on, they have no idea what you're saying. They rely so much on lip reading, and I don't think many people realize how much they relied on it until the pandemic started. So it's tricky. I mean, there's different ways of communicating with people. So if, for example, someone is hard of hearing or they can't speak, sometimes they can read. So we would write it out for them in a way that's easy to understand for them. I'm not kind of British Sign Language trained, but I know people who are, for example, deaf. They come in with someone who is British Sign Language trained, who can kind of hear and also then translate across. So there is that. But yeah, it's tricky. It's difficult. It's not easy at all.
Yeah, that's really interesting. What you sort of said about seeing patients in their environment. I think, especially since, you know, GP being the first point of care, it's important to realize that there's so much going on outside of a person's acute set of symptoms. So in terms of video consultations, you said that was quite helpful. Do you think that's something that GPs should maybe implement a bit more? So seeing the patient in their home environment or wherever they're staying?
I think we've adapted in a really interesting way now. So, you know, previously it was just face to face. So, you know, always think, you know, when someone's going to make the effort to go out of their house, they will wear their nicer clothes, they'll make themselves look presentable. You know, you have absolutely no idea what's happening in that person's house. There's very few people that come out of their houses looking like what their house looks like, if that makes sense. You know, everyone puts an effort when they go out. So you do learn a lot about someone's home situation by seeing them. And historically, that's been with home visits. Which, yes, they involve a bit of travel. I remember I worked somewhere in my training and I'd have to sometimes travel out 15 miles, I don't know, in the middle of the sticks, and I'd be trying to find some farmhouse randomly in the middle of nowhere. However, still seeing that environment for that person, there's no way you can describe how useful that can be sometimes, especially for people that are starting to struggle with their kind of daily activities and things. So video consultations are sort of the next best thing, so to speak. So, you know, if, for example, you're concerned about someone's welfare, again, you know, a lot of people who you're concerned about with their welfare might not have technology, so you might not be able to connect with them on video. But those that do, for example, you might see interesting things around the house that are relevant, or you find that's a bit odd. You know, why is that there? You know, that's not what you would normally see in someone's house. And also, it's just, sometimes we're a bit nosy. We just like to look at the way people live, because we learn about how people live and what people do in their lives and things, and that can sometimes tell us. So again, this is a part of medicine I really didn't realize was important until I started my GP training, kind of knowing more about just what you see of the patient and actually the environment that they live in.
Yeah, that's really interesting. Thank you for sharing your insights on that. We have lots of really, really good questions. Unfortunately, I think we should switch over to the next case now, but these questions are saved. So if we have some time at the end, we'll definitely come back to some of these. So I'm just going to switch back to the slides for the next case study. But thank you again, Alif and Dr. Zirva, for that really great case study. Just give me a moment, I'll switch back to the slides for the next case. 1 second. In the meantime, if there are any questions in the chat, maybe Dr. Zirva could take a couple of them now.
I actually thought something for this particular patient, the memory issue could make me really worried about like having like early onset like Alzheimer's or something. So how would you go about like making sure like they're like you're excluding the worst possible thing and just making the patient feel like, oh, okay, this like spot that's grown on my arm isn't skin cancer, but actually it's just like another wart. Like, how do you kind of go about dealing with that sort of problem?
Good question, because for example, a lot of people come to us with lumps or bumps or memory problems, and the first thing they'll ask us is, I think I've got dementia, doctor. So, you know, you can sit there and be like, you really think you got dementia? Honestly, seriously, I don't think that dementia is on the cards. Or cancer. Okay, right, we don't see cancer in this age. So a lot of it is how you kind of talk to the patient as well. So, you know, make sure you gather all the right information so that patient trusts you, that they trust that you are taking their concerns on board. And like I said, sometimes things sound in a way where you're like, oh my God, what the hell? But like, you always put yourself in that patient's position. So, you know, for you, like someone with memory problems, it might be affecting their relationships or their work, or, you know, they might have been sent home because it was causing them problems, or they might have fallen out with people because of it. So you can't underestimate the effect. You know, it's the effect on the patient. That's what matters. It doesn't matter what they're actually thinking, is the effect of it. So for example, lumps and bumps, you know, even though I know if, for example, in a young person who's 16 with a lump, I don't know, on their arm, the chances of it being cancer are pretty much zero. However, I will still look at that and I will still examine it, and I will still look at it as if I'm trying to rule out something like cancer. And then I will explain to them afterwards why I think it's not cancer. And what I found is they tend to trust you more because you've taken that time to listen to them, take their concerns on board and try and rule it out. But also you've given them kind of like an alternative, which seems to fit more like with the picture. That's why they come to you as a doctor. With sort of memory problems, sometimes what we do is a memory test or a memory screen. There are lots of memory tests. Some memory tests are really long. They take about 10-15 minutes on their own. Others are dead quick and they're like two, 3 questions. And then you've got a very good idea whether they do have a memory problem or not. Obviously, in this situation, we didn't do a memory test because I didn't feel it was entirely appropriate. It wasn't affecting you that much. But say, for example, you had maybe given me a bit more information that got me a bit more concerned, then I think, do you know what, let's do a memory test. There's no harm in doing that. I hope that answers your question.
Yeah, that's helpful, thanks.
Great. So we'll move on to the next case study now, if that's all okay. So this one will be with our new actor, Maud. So we'll just do a quick summary of the case background, and as similar format to the previous case, you guys can think of some questions to ask the patient. So the patient is a 24-year-old woman who gave birth to a healthy baby girl 20 days ago. She's come to see the GP to discuss her extreme tiredness and sleeplessness. She's been experiencing a low mood, cannot enjoy the things that made her happy, and has lost her appetite. Upon further questioning, she mentions that she's lost interest in her child and feels like she is a bad mother. So, what questions would you ask this patient? Just have a quick brainstorm and put them in. And while they're coming in, Dr. Zirva, if you have anything to sort of comment on.
I think they all seem like fairly sensible questions from what I can see on the screen to start with anyway. Let's see again how many of these I end up using. Great.
Okay, so we're ready to start whenever you are.
Okay. Hi, is it Maud?
Hi, yeah.
If I pronounce your name properly, sorry.
Yeah.
Hi, my name's Dr. Khan. I'm one of the GPs, and we've got a video consultation with you today. Can I please just confirm kind of your full name and date of birth?
Oh yeah, Maud Just, 28th of March 1997.
Okay, and how can we help you today?
Well, so I gave birth about 20 days ago, and ever since I've just been very tired, and like I try when the baby's sleeping, go to bed and everything, but I just can't sleep, even though I'm just so tired. And yeah,
Okay. So congratulations on your baby girl. I mean, how was the how was your pregnancy and how was your delivery?
The pregnancy was, I mean, okay, I guess, for a pregnancy. The delivery was okay. I mean, yeah, just since I've just been very tired, it's been a lot of work, I guess.
Yeah, I mean, how have you been coping? Is this your first child?
Yeah.
Yeah. So how's it been, having a baby?
Yeah, it's been, I mean, it's just been a lot of work. My husband has been working a lot, so it's just been me and the baby at home, and it's just, yeah, looking after the baby, and then when the baby's sleeping, but I can't, so I've just been very tired and just feel like a bit, yeah, worn out from all of it.
Yeah, I mean, it's a complete change, isn't it, with having a new baby and changing your life to accommodate for the baby. So you mentioned that you feel like even when you have tried to rest and things, you don't feel like you still feel quite tired. And I mean, how has that been affecting your ability to, say, look after your daughter?
I mean, I've been looking after her. I don't know if I'm providing everything because I'm so tired. I don't know if I'm quite providing everything she needs. Yeah.
So when you say that, what do you mean by that?
I don't know, like, I've looked after her, I guess, feeding her, whatever, but I don't know if I'm really sort of giving her that motherly care that she might need. I don't know.
Yeah, I mean, that's quite a difficult way to feel. How long would you say you've been feeling like that since the very beginning?
Yeah, probably.
And how was your, with all of this, how has your mood been?
I mean, not the best, I guess. Just, yeah, not doing much, and yeah, just tired. Yeah, I haven't really found being able to do much on, like, apart from looking after the baby, I guess.
Are you sort of managing to look after yourself, so like eating and drinking?
I've been trying to. I'm not really that hungry at the moment, but I mean, I eat when I feel hungry, I guess.
Okay. And sort of what about, showering, having time for yourself, a bit of time to rest?
Yeah, a little bit. Yeah, sometimes my husband will sort of remind me to have a shower and things like that, but yeah.
Sounds really difficult. You said that because your husband isn't around as much, have you had anyone else to try and help you and support you?
I mean, a few of my friends have messaged me and stuff, but I mean, with COVID and with looking after the baby, it's been a bit like difficult, and I haven't really replied to any of them much because I don't really see when I would have the time, and yeah, so not much.
You mentioned as well, with your mood being low, what I wanted to ask you was, how low would you say your mood has been?
I mean, I'd probably say, like, the last time I think my mood was like this was probably when I was in university. I had a bit of a problem. I had a bit of mild depression back then, and I think this is the lowest my mood has been since then.
Has it been, have you felt so low since you've had your baby that you've wanted to do anything like harm yourself or end your life or anything?
I wouldn't say end my life. It's just tiring sometimes, and yeah, I wouldn't end my life, but yeah, just tired.
Yeah. So you mentioned that you had mild depression when you were kind of a bit younger. What sort of treatment did you have for that? Do you remember?
I had counselling. Well, yeah.
How was that?
It was nice to have someone to talk to, and yeah, it was good.
Do you have any family around or close to where you live?
My parents live abroad, and so with COVID and everything, I haven't seen them in a long time.
COVID's been awful. COVID's been horrible. I think for so many people. How would you say that you've kind of coped with the COVID restrictions and everything?
I mean, it's been okay. I mean, because I was pregnant, I wasn't really physically able to do much anyway towards the end, so didn't restrict me too much. But yeah, I mean, as I was saying, I haven't really seen my parents and my friends as well. I just don't really see, like, I don't want to, yeah, I don't want to put the baby at risk or my husband at risk, so I haven't really been seeing many people.
It's tricky. It's really, really tricky. So you mentioned that you've been obviously feeding your baby. So how are you feeding your baby?
Breastfeeding.
And how are you finding that?
It's okay. I mean, I think the baby's getting enough. I hope that I'm providing enough.
I'm sure you're doing a lot more than what you think. And I suppose what's been tricky is you've not had anyone else to kind of reassure you about that as well. Are the health visitors and everything okay? Happy with baby's growth and development and stuff?
Yeah, they say they are, yeah.
Yeah, that's good. So kind of, I can see on your medical records, apart from the mild depression that you've mentioned, you're not known to have any other kind of health problems, is that right?
Mm-hmm.
Okay. And are you taking any medication right now?
No.
No? Any allergies to anything?
No.
No? And obviously you're on maternity at the moment, at home and things. Sometimes when people feel down and they feel kind of worn out, sometimes they might turn to other things to try and make them feel a bit better. So do you smoke at all?
No, I don't smoke.
No? Do you drink any alcohol?
No, I stopped during the pregnancy. I haven't again since.
Okay. So, I think you've done so well by coming and having a chat with us, because that's often the hardest thing, sort of realizing that there's a problem and that you might need some help. When you kind of made the decision to contact us today, was there anything in particular that you were hoping we could do for you?
I mean, I guess just helping with like how tired and that I can't really get any sleep and all that, because I want to not be so tired so I can look after the baby properly.
Yeah, no, I think that's completely reasonable. So, I mean, you've given me lots of kind of really useful information, and I'm really glad, like I said, that you've come to have a chat with us today. I suppose what I'm worried about is that your symptoms seem to be perhaps very similar to what you had previously with your mild depression, maybe even slightly more. And it's tricky. I've seen it with a lot of new mums or mums that have become mums during the pandemic, because they are so much more isolated than people have been historically. It means you've just not had the normal social support, from your family, from your friends. You've not been able to necessarily go out to the places that you would have previously done, go out for a coffee somewhere. I mean, shops have only just literally opened recently. So it's really hard. And being a new mum and, having your life completely changed overnight, where before you could do what you wanted when you wanted, really, and to now being almost bound by a baby and what they need is really hard. So there are different ways that we can try and help you. Are you all right for me to talk to you about those things? And then you can let me know what you think.
Yeah.
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 Was there anything in particular that you were you thought about before we'd had a chat today that you might want to have done, or?
No, not really.
Okay. So when you've been through a time like you have, you know, having a baby, the delivery, these sorts of things, sometimes people do actually develop some kind of deficiencies as well. So I don't think there's any harm in doing some blood tests just to make sure that you've not become anemic or anything like that. That might be contributing towards your symptoms and the tiredness, which you've, you know, is clearly something that's really affecting you. The second thing that I'm a bit more worried about, which is, you know, related to your mood, is whether you might need some help for that. So there's different ways that we can give you that help. One of the ways is we have a local unit called the Parent and Baby Unit. So they're kind of run by a group of kind of a mixture of midwives and psychologists, and there are a few doctors that work for them as well. And essentially what they do is they, you know, kind of talk to you about the stuff that we've spoken about today anyway, and really just try and help you with that. So, you know, whether that's with counselling or with other sorts of support, just to really try and help you not feel as down as you have been, and kind of give you that confidence back, because, you know, you're clearly doing more than enough for your child if she's growing and, you know, thriving. But that kind of guilt and that feeling that you're not doing enough, you know, that worries me, and I'd really want you to get some help for that. Sometimes people kind of, in addition to that, might want to consider medication as well. The risk we have with medication is you are breastfeeding, so there is kind of a small chance that some of that might pass through the breast milk. But some people might say, do you know what, it's affecting me that much that I just want to give it a go. And then in that case, we just sort of weigh up the risks and benefits to see what would be kind of your preference and what would be right for you and things. So don't know what you think about those.
Yeah, I mean, I think the blood test is fine. Maybe was it the mother baby sessions sounds, yeah, that might be good.
Yeah, so I'm more than happy to do that referral. I mean, we can always get back to the medication thing anyway. There's because I think it's the kind of mother and baby, parent and baby department that will be probably more helpful for you. So I'll do that as an urgent referral today, and they should be in contact with you in the next couple of days. If you've not heard from them, do contact us back just to make sure that everything went off okay and that there wasn't any problems. The blood tests really straightforward. So all you need to do is just call back when you get a chance and book in with us, and then we'll just check that through. Have you ever heard of the crisis team? Do you know like what to do in an emergency or anything like that?
No, I'm not sure.
Okay. So one of the things I try and advise all my patients who are similar to yourself is that you should know who to contact in an emergency. So in this area, it's the crisis team. And I'll text you their number afterwards. So that is if you start to feel like your mood is becoming so much worse, you've started thinking about harming yourself, or you're starting to have thoughts about ending your life, it's the crisis team that you'd call. And if you forget about the crisis team, as long as it's the ambulance emergency services, that's fine. But I think in the meantime, I mean, do you have any plans at all now that like COVID restrictions have started to ease?
A few of my friends have messaged me, so I think might see them at some point, but I haven't really replied much or planned anything yet.
Yeah, I mean, it can feel really daunting when you've you know, just had a baby and you're just trying to figure out what's going on, and you feel awful yourself to sort of have the energy to go out and see people and be sociable. But you know, we do find that actually when you distract yourself and you keep yourself busy with things that make you happy, that will actually really help with your mental health as well. So, you know, maybe think about getting back in touch with your friends and going out for a walk. You know, the weather's much better at the moment, and you know, you can invite people over with the restrictions easing and stuff. and just try that out for the time being. I think if you can, maybe get husband on board as well. Do you think he'd be wanting to get on board with that?
Yeah, I think so. I don't. He's been working a lot recently to like help provide. So I don't want to stress him out too much. But I could mention it to him.
Yeah, you'll be surprised. Even when kind of they're busy with working and things. Actually, I think he'd much rather he know how you feel than not know, because he might be able to help you. He might be able to look out for you a little bit more. But I was wondering, do you want to have a chat in a couple of weeks just to see how you've got on?
Okay.
Yeah. So we'll put you down for a follow-up appointment in a couple of weeks' time. I can just give you a ring and have a chat. And obviously, if in the meantime you have any concerns or anything changes, just arrange an appointment beforehand. Is that okay?
Yeah.
Do you have any
thank
questions
you.
at all?
I think that's everything. Thank you.
No problem. Well, I hope you get to make some nice plans over we've got the bank holiday weekend coming up, and you've got good weather and things. But otherwise, we'll be in touch in 2 weeks' time.
Thank you very much.
Take care.
Thank you.
Bye.
You too. Bye.
Thank you. That was really great. Very lots
I
of.
feel like I'm in an exam.
No, there's so many interesting things to discuss, I think, with that case and with the previous one as well, kind of contrasting and comparing the two. So thank you, Maud, and thank you, Dr. Zirva. So now I'll just change slide. So if the students, if you guys could, I think the Menti has not updated. Give me 1 second. But if everyone could have just a quick brainstorm, maybe Maud, you could talk a little bit about how that felt as the patient, like Alif did.
Yeah, I mean, it's quite intense having sort of like do all those and sort of think about how a patient in that situation, like how they might reveal information, so to speak, or not, and how willing they will be to answer questions. I think it's really nice. Dr. Zirva was really good at like sort of asking really like questions open, but then also closed as well, and was like, I could really, like, I felt like she was listening, and I felt like it was a safe space to sort of talk about how the patient was feeling. Yeah, and it's quite intense things to talk about, but I think Dr. Zirva really handles it well.
Yeah, thanks for sharing that, Maud. So the Menti I don't think has updated, but if anyone would like to sort of put in the chat what sort of key skills they observed, and we can kind of go through them with Dr. Zirva. Sorry, someone's just asked about what time the webinar ends. It finishes at 4 today. So Dr. Zirva, as you can see in the chat, there's loads of really great things here. Empathy, communication.
Oh my God. You try, don't you? You try. And it's like I said, we don't always you get so lost in your like day-to-day work and things, and you just kind of go into your flow. So I always find it really kind of nice, endearing, kind of seeing feedback. This is indirectly feedback of how I did in my consultation. So it's nice. Yeah. A lot of empathy.
Yeah, really quite a common one.
That's nice. I like that. Yeah, I'm glad Maud felt comfortable, because I really tried my best so that I would make her feel comfortable. I think before I had my own child, I really didn't know what it was like to be a new parent. And that in itself sort of taught me a lot about just how much your world changes. I didn't have any, thank goodness, I didn't have any mental health problems around the time of pregnancy or anything like that. But just like the normal changes are quite a lot. But I was really lucky, 4 years ago, I could go to see my mum, I could have people over, I could have people taking my son away from me for the night while I had some rest and things. and people really haven't had that. And we've had so many women who've had babies in the last year since the start of the pandemic. Again, record numbers of postnatal blues, postnatal depression, even kind of to the extent of psychosis because of just how much it's affected them. And you don't realize it until those support mechanisms are taken from you. So it's difficult, and it's really important that, again, you give the patient the chance to talk. And I guess what we saw here, I don't know whether anyone noticed, but Maud needed a little bit more probing to get kind of a big amount of information from her. She did say that obviously she wasn't generally, she was feeling very tired. That was the main thing. Tiredness was what it seemed like, but tiredness is, again, a very common symptom of depression. So yeah, and I think, one question I get asked a lot being a GP is, how do you have these consultation in 10 minutes? Because as you could tell, I think I timed myself, it must have been about 12, 13 minutes, something like that at least. There's no way you can do that in 10 minutes. I think obviously for exam purposes, when I was a GP trainee, yes, I could have done it in 10 minutes. But if you want to do it in depth and things like that, you do sometimes have to give them more time. And I don't think there's anything wrong with that. Yes, okay, my clinic will run behind. So, if you are a patient of a GP and you're running a bit behind, and you're having to wait a little bit, they could be having a consultation with a patient like this. So I think it's always really important to be sensitive to that. So yeah.
Yeah, thank you for sharing. So we have a few points to sort of discuss from that case and a few questions that are coming up in the chat now. So diagnosis, of course, is it's quite an acquired skill over years of practice. But if you could kind of talk us through a little bit about how you would arrive to a diagnosis, how you kind of get a patient from telling you their history to actually pinpointing what it might be, that'd be really helpful, please.
So I'd be giving away the secret of medical school, wouldn't I, by telling you exactly how I get to the diagnosis. I'm kidding. It obviously takes without sounding thingy, you go through so many years of medical school and then so many years of being a kind of a junior doctor and then a trainee GP, etc., and then you eventually kind of become to, like, I'm a GP now. And all of those years of experience will teach you how to get to that point of making a diagnosis. So, for example, in the beginning years of when I qualified, I probably wasn't as good as making a diagnosis, and I think part of that was just confidence. So obviously we have all of this information. It's a bit like diving into the ocean and trying to figure out exactly where you want to swim to try and find, your escape route or something like that. So, in this instance, I suppose there was very vague information, but understanding more about the patient and kind of what she's recently been through, and not underestimating the circumstances that we are in. So literally the main thing I want to emphasize with a lot of consultations at the moment, COVID is playing a huge part. Anyone here who is going to be, applying for medicine, who's going to be going for interviews in the next year, COVID is going to be a big part of all of that process. And you can't underestimate that. We can't ignore it. It's happened. We've lived through it and we are living through it as well. And we have to talk to our patients about it. We have to try and kind of understand how they've coped and how they've managed. So when you take that on board, and the fact that she's a new mom and she's quite isolated, that is tiring. It's understandable why she's tired, but I suppose what concerned me more is she has a previous history of depression. So again, it kind of moves me a little bit more to, could this be just a mental health problem? Again, you can't always put everything down to a mental health problem with tiredness. So when people have babies, they lose a lot of blood. When I was talking to her, said she was eating when she was hungry. God knows how often that is. That might be once a day. She's feeding a baby. She's very kind of high risk at losing nutrients during that. Breast milk has a lot of nutrients that your body gives away. If you're not eating properly, if you're not taking any vitamins, you're not looking after yourself, you are going to be losing a lot. So doing some blood tests and just making sure is really important as well, because you don't want to, again, put it to one thing and actually you've missed that she's got all these deficiencies that you could have been treating as well in the meantime to help her. So yeah, once you have all this information, you start getting clues, and then you kind of just follow the lead of the clues. And that's when you ask all of those specific questions to kind of head you that way. There are some times where you get given the information and you've tried to ask in one direction or another direction and you're literally getting nowhere and you still feel just as clueless as when the consultation started, in which case, I guess what I do in those instances is just tell the patient, like, you know, a lot of people are like, oh, as a doctor, you know, what happens if you don't know the answer? It's like, well, yes, a lot of the time I don't know the answer, you know, that's quite normal. I don't have the answer to everything. I only have the answer to the things I know about. So in that instance, I'd just be like, you know, I appreciate this has been affecting you so much and etc. However, at the moment, I'm really not sure what's going on. Sometimes giving a bit of reassurance, you know, if you've asked all the questions about ruling out like a sinister thing like a cancer or something else life-changing, then you can give them that information and that sometimes makes them feel better. But like I said before, the concerns, if you've addressed the concern, so if they've come with something and they think it's cancer and you're like, I'm pretty sure it's not cancer, and you give them the information and the reasoning why, they'll actually be much more reassured than you will. You're a bit more puzzled because you're like, I still haven't got down to the bottom of, you know, I've not solved the case yet. But you don't have to solve the case straight away. You know, you can have as much time or as little time as you need for that. So yeah, my whirlwind explanation.
Yeah, that's really helpful for us as medical students as well. There are some really, really great questions in the chat, really some really thought-provoking ones. So
the best one I've read is someone wants me to start a YouTube channel. Oh my God. I'm joking.
Let's see what else there is. Okay, so I really think this is a really great question. So how can you differentiate between a patient who feels that they're not doing enough for their child but are, versus a patient who really isn't doing enough for their child?
That's a really hard one to answer. And again, I'm not really sure that I would necessarily have all the information to be able to come to that straight away. And then how you deal with what you think about it and what you've come to is just completely a different thing. But most parents are doing enough for their child. You know, if they care enough about their child that they can feed them, you know, they're growing, there aren't any concerns from anybody else about that child and the welfare of that child, then you are doing more than enough. You know, I think it's very subjective as the child gets older, whether you are doing enough or not. Like, for example, my son is 4. I parent maybe differently to someone else who's got a 4-year-old. There's no right or wrong way to parent or right or wrong way to provide for your child, as long as your child is happy, they're thriving, they're growing, and you know, they're happy and they're comfortable, they're safe, they're being looked after. In other instances, I suppose we see, like, I did a gynae job for 6 months, and I spent a good amount of time doing an antenatal clinic, so a clinic where pregnant ladies would attend, and they have substance misuse problems. So these are like heroin addicts who've become pregnant or alcoholics who've become pregnant. And I learned quite a lot from that, because a lot of these women were going to become mums again. However, they'll have had children before that were taken for adoption, or they'd been fostered, or so these women will have had 6, 7, 8 children each, but they might not have children that were living with them anymore. And I suppose that's a completely different sort of conversation, you know. When people have addictions, or even if, say, for example, let's talk about depression, because depression is what we've just seen in Maud. If she was so depressed, she was forgetting to feed her child. Her child wasn't growing. Her child, you know, the health visitor had concerns about her child, which, to be honest, this is more likely to be picked up in the parent and baby clinic anyway. I will never be able to have all that information to be able to come up to those suspicions and things. If there was concerns about the baby's growth and development and welfare at the clinic, then that's, I suppose, where you would think perhaps she's not doing enough. But again, you have to look at it circumstantially. If you've got a mental health problem, mental health problems can make you do that. I'm not saying it's the right thing to do, but you know, we're lucky we live in a country where the welfare system and the healthcare system cares about everybody in that kind of unit rather than just the patient. So the patient is obviously important, but if the child is at risk because of the parent or the patient, then there are mechanisms to protect that child. So we are really lucky in that way. If there are circumstances where you think actually you worry about the child's safety and welfare, you would raise a safeguarding concern, which again, it's like a whole topic in itself, and it's very hard. It's a very hard conversation to have with families. Thank goodness I've not had to do it much. Most of us don't, you know, once or twice in a year we have these conversations with people, but they're really hard. Some parents themselves say, I think I need to raise some safeguarding concerns because they're worried about the safety of their child and things like that. So yeah.
Yeah, that's really great. Thank you again for sharing that. And also, again, lots of really great questions. So there's another interesting one about, I guess, the stigma around mental health and treatment for mental health. So someone has asked, if the patient was opposed to antidepressants or a support group due to maybe anxiety or stigma, how would you deal with that?
So really good question. This is another hat that I wear. So one of my interests is mental health in ethnic minority communities. So I'm from a South Asian background, and I'm also Muslim, and there is huge stigma in our communities and culture about mental health. And I work at a surgery where there's predominantly non-British people, and a lot of them have mental health problems, and it is such a difficult conversation because you literally have to go down to as raw as it gets to talk about what it is. So obviously you start where you say, okay, I'm concerned about mental health problems and I think you need some help. Then the conversation will be like, well, don't really want to get any help, to be honest. I think I'll be fine. And it's like, oh, okay, do you really think you're going to be fine? How do you think you're going to be fine? What are you going to do to try and make yourself fine? Oh, I'm just going to, I don't know, whatever they might say. You know, some people that are quite religious might say, I just need to pray more, I need to do this, I need to do that. And to be honest, there are a lot of people that do have mental health problems and they can kind of figure out how to make themselves better by themselves, but not everybody can. So those conversations are quite difficult because you literally just have to go down to as basic as, did you know mental health problems are just as common as physical health problems? Did you know mental health problems happen just like physical health problems do, where, you know, it's not because you're a bad person, or it's not because you've been cursed, or it's not because of this or that. It is literally just because it happens. And then when you talk about the evidence and the treatment and the things that there are out there, you have to be so patient. And a lot of patients at that point will say, look, I just want to think about it. And you have to give them that time. At the end of the day, if they're adults, they're allowed to make a decision of their own. And they've come to you for a medical opinion, you've given that, they want to then think about it, and that's kind of their entitlement. As long as you give them kind of information, safe information, so they know where to get the help whenever they need it. Things that are helping at the moment is a lot of communities are getting kind of communities where, for example, there is more stigma. There are kind of, for example, faith-specific organizations and charities that are upcoming now. There's quite a few of them that have popped up, especially over COVID, where people can access them, and they seem to relate to them a lot more because they think, actually, do you know what? The person that will be helping me looks like me, sounds like me, understands where I'm coming from, understands the lifestyle that I lead. So they're actually more likely to get where I'm coming from and help me, which unfortunately, the NHS is guilty of. You know, we don't have representation in these places. Representation is my biggest bugbear. We do not have enough representation in the right places to help our patients. So, you know, all the reports that people read about people from different communities, races, it's all true. All of it's true. And a lot of it is just because of the lack of understanding between them, communication barriers, you name it. So many barriers that there are. And I think sometimes just by acknowledging them and seeing where the patient comes from really makes a big difference. They think, actually, someone's listening to me for once, rather than patronizing me or making me feel guilty because I'm not getting the help that I need.
Yeah, that's really important. Thank you so much for sharing your advice on that. So I think we'll take this as our final question, but a common theme that I think that we've seen today from this session is being a doctor is so much more than just like looking at a patient's issue and coming up with a diagnosis. There's so much involved in a sort of social way as well. And all of those soft skills are absolutely critical to being a good doctor. So is there any sort of advice that you would give to our students at the moment who are kind of aspiring medics, things that they can do to improve their soft skills and kind of gain that background to make them really successful doctors at the moment?
So one of the things I'd say is don't kind of put pressure on yourself to try and be someone that you're not. I do think that it takes a type of personality, and you have to be curious. You have to really want to know about a person, and you want to be curious, and you want to learn about things, and you want to. I always think just put yourself in that person's shoes. It's like when you have friends, right? So if your friend isn't well and they want to talk to you about something, just like you would give your friend the time, the kind of space, you'd give them that undivided attention to listen to them and things. Do that when you meet people, especially on your placements. So if, for example, you do have placements where I know because of COVID this is like really difficult, but even just the virtual stuff that you're watching and stuff, just really try and put yourself in that person's shoes and try and just see where they're coming from. Try and understand more about them. I didn't understand the value of a social history, which is how they live, who lives with them, what job they do. I didn't understand how important these issues are when trying to come up with something like a management plan to help a patient. And I think as you do that kind of bit by bit, as you start to learn a little bit more, you will kind of become just that little bit more curious to want to know a little bit more. Again, it's hard to kind of get to a point where you're not too nosy, because a lot of doctors, we have to, like, I'm not someone that's ever been nosy, but I've had to learn to become nosy to be able to do my job. But you also can't be too nosy, because your patients will be like, what are you doing? Like, don't need to know that much information about me. But yeah, I think just really try and live the experiences that you've got, especially when it comes to applying for medicine and things. And those experiences can be anything. If someone's telling you a story, if someone wants to tell you something, just listen to them and just try and really experience that. I know it sounds all a bit fluffy and stuff, and takes a bit of practice, but if you do that enough over the many years of medical school and becoming a doctor and stuff, it will fine tune. I'm still fine tuning. I'm changing and I'm evolving and developing all the time, just like everybody else will.
Great, thank you so much. That's amazing advice. I'm sure we're all going to take that on board now.